Clover leaf skull in a case of Thanatophoric dysplasia. This was seen in a 36-year-old gravidafor at 34 weeks of gestation. The cranial malformation was diagnosed at 18 weeks, but the physician may be unaware that actually this is a lethal anomaly. So she had elective cesarean section due to 2 previous cesarean deliveries at 34 weeks on account of thanatophoric dysplasia, which is a lethal congenital anomaly. A clover leaf skull is a rare and severe congenital cranial deformity caused by premature closure of multiple cranial sutures called craniosynostosis. Most commonly, it occurs in the coronal, lambdoid, and sagittal sutures. Early fusion of these sutures restricts growth at those sites. However, the brain continues to grow, causing the skull to expand at confused areas, particularly the temporal regions, producing 3 bulging lobes, resembling a 3-leaf clover on imaging and physical examination, as we shall see. This is often accompanied by hydrocephalus and other intracranial anomalies. Frequently associated with skeletal dysplasias, and the most common is thanatophoric dysplasia. So this is the video targeted to the fetal skull. You can see the appearance of the skull, the dilated lateral ventricles, dilated anterior bones here, bulging towards the ear, so towards the temporal region. So you can see this bulge here. You can see another bulge somewhere here, but the view is limited because of this extensive shadowing. See that dilated anterior horns. The pinna is in here. You can see the placenta is stretched out because of the polyhydramnios. So let's look at the still images. You can see the bulge here towards the pinna here, the ventriculomegaly, destruction of the septum pellucidum, dilated anterior horns. But look at the umbilical artery loop, apparently normal, but this is not a placental pathology. This is the 3D image. You can see the frontal boson clearly. And here you can see the bitemporal and frontal boson. typical of the clover leaf. So this is a case of thanatophoric dysplasia with clover leaf. It's called lethal congenital anomaly. Thank you very much for listening.